Welcome to the Defeating Epilepsy Foundation YouTube channel. At the Defeating Epilepsy Foundation, our mission is to provide the advocacy and educational resources needed to the epilepsy community and our society. We are dedicated to removing the stigma associated with epilepsy and help to create opportunities for individuals battling epilepsy. In this discussion, we will learn what post-traumatic stress disorder is, the signs and symptoms, the difference between PTSD and complex PTSD, how post-traumatic stress disorder can affect someone battling epilepsy, and resources available to help someone who is battling post-traumatic stress disorder. Post-traumatic stress disorder is a psychiatric disorder that may occur in people who have witnessed or experienced a traumatic event. Serious accidents, war combat, rape, sexual assault, child abuse, and domestic violence are just a few examples of how someone can develop PTSD. 1 in 11 people will be diagnosed in their lifetime and can affect anyone. I myself have been diagnosed with post-traumatic stress disorder. I was about the year 2008, and many things it ties back to a very dysfunctional childhood, growing up in a very toxic home, dealing with epilepsy, and having some very unfortunate, unnecessary traumas such as being violated. A lot of things people don't realize when it comes to PTSD is things add up when we experience trauma, and our bodies, after a while, just cannot hold in the pain and trauma anymore. So it's very important when you meet somebody who is dealing with PTSD to be empathetic, because they're dealing with a lot of very painful memories that could be affecting them for many, many years. So it is essential as we go through this discussion how important it's going to be to notice the signs and symptoms, and when you know someone who's battling PTSD, what you can do to help them. There are 4 main signs and symptoms of PTSD. Intrusion involves repeated, involuntary memories, distressing dreams, and flashbacks. Avoidance happens when survivors avoid places, activities, and situations that can trigger distressing memories. Alterations in cognition and mood can result in someone not remembering certain aspects of the event, having negative thoughts or feelings such as rage, guilt, and shame. Alterations in arousal and reactivity can result in the person becoming angry, having outbursts, behaving recklessly, and having problems with concentrating and sleeping. I have experienced many of these. Probably the most frustrating for me are the distressing dreams or night terrors, because I can't even really remember the dream, but I wake up either very frightened or very angry, and it takes quite a bit of time before I can calm myself down. The other thing that I've had is the alterations in cognition and mood. Depending on the situation, I can become very hypersensitive and become very assertive really quickly. And rage, at one point I was very rageful. Thankfully, because of being on Lamictal and going through therapy, that the rage has greatly decreased and that I can find other ways to control my emotions. The hardest thing, though, is the cognitive impairment. I have scarring on my hippocampus and shrinking of the hippocampus, and that is where a lot of the frustrations and problems come for people who are experiencing PTSD. So for somebody who is already dealing with epilepsy and having complications already, to have this on top of it, it's a very aggravating situation. So when you're advocating for yourself or you're advocating for a loved one who's battling with both, it's essential to find a good doctor who is going to take the time to listen, to make sure the proper plan is in place for them, to make sure that they can find some peace in dealing with this. Complex post-traumatic stress disorder has similarities to PTSD. Many who experience trauma as a child are more likely to develop complex PTSD. Along with the symptoms of PTSD, People with complex PTSD may experience the following symptoms: dissociation, headaches, dizziness, chest pains, stomach aches, isolation from friends and family, relationship difficulties, destructive and/or risky behavior, self-harm, self-medication, and suicide tendencies. For those battling suicide tendencies, call the National Suicide Hotline at 1-800-273-8255. I have dealt with many of these things. The headaches, most definitely. Stomach aches, IBS symptoms, absolutely. Probably the biggest thing that has helped me to get my PTSD under control is I had to isolate from a lot of my family. My friends, it was the opposite. My friends became my family. But my actual family members, I do what I can to have a civil relationship, but at a distance. They're in New York, I'm in California, and as cold as it might sound, I need to keep it that way. I need some distance between them because I know with the toxicity they have brought into my life, sadly, that's a trigger for my seizures, it's a trigger for my PTSD, and it will send me into a spiral, a very downward spiral, if I am too close and talking too often to them. I've had suicide tendencies in the past, and I have, thankfully, after all the years of dealing with this, I can see the patterns if something is going bad and I'm starting to feel down and I'm not being able to pick it up in time. I know what to look for, and I put together with my therapist a plan of when I find myself heading that way, why am I heading that way, and what can I do to get away from it. So a lot of the healing from this, it has to start with you wanting to heal. A doctor cannot wave a wand and make this pain, make these symptoms go away. You have to make up your mind you want it to go away. And I can say from being in very intense therapy for sexual assault trauma, it doesn't go away overnight. In fact, for me, when I started therapy, it got worse before it got better. So that is something to keep in mind if you make the decision, if you're dealing with this and you decide to go through with therapy. Realize when you're bringing up these events, talking about events that caused this to happen, you will feel some pain, you will feel anxiety, you will feel a lot of negativity at first before you cross that path and start to heal. Having a seizure can be very traumatizing for many, and some people develop post-epileptic seizure PTSD. Individuals who experience anxiety and depression are more likely to have PTSD. Anxiety and depression are common symptoms for many battling epilepsy. PTSD can have a negative impact on the brain. PTSD can cause shrinkage of the hippocampus, resulting in flashbacks, nightmares, and cognitive impairment. Treatments for PTSD are psychotherapy and medication. Cognitive therapy is talk therapy that helps to recognize a person's way of thinking. It can help to alleviate negative thoughts and prevent recurring trauma. Exposure therapy helps individuals with PTSD face the situations and memories they find frightening. It can help with reducing night terrors and flashbacks. Eye movement desensitization and reprocessing, also known as EMDR, combines exposure therapy with a series of guided eye movements that help you process traumatic memories and change how you react to them. Antidepressants can help with symptoms of depression and anxiety, reduce insomnia, and improve concentration. Anti-anxiety medications can relieve severe anxiety and related problems. They are only used for a short time due to people abusing them. I myself have gone through cognitive therapy just as a way, as it clearly says, to recognize your way of thinking so that you can learn different ways to step back and reassess situations, and slowly it helps you to learn how to react in other ways. And then exposure therapy is probably one of the ones that my therapist has helped the most with. I admit when I first started exposure therapy, I really did not like it at all. because the techniques we did, it made you face your trauma. Probably one of the biggest ones is I had to do an exercise where my child self was communicating with my adult self. And I got maybe into a couple lines of this conversation I was supposed to be having with my child self. And I knew the first thing I wanted to do was ask that child, are you okay? And I couldn't go through with even asking that question because I knew the answer was no. And right at that point, I didn't even want to go further because I didn't want at that time to even start digging up why things had not been okay in my childhood. So it does help with facing situations that were really horrible in the past. But it's something that you have to be ready for and take baby steps towards, or else, at least in my situation, I found it brought a lot of the symptoms of PTSD up, especially anger. So eye movement, the EMDR, I've never experienced that. I've never had that as treatment, so I can't comment really on what it would be like to go through that. And as far as medication, first, and when it comes to any medication, I'm not a doctor, so please, if you have any questions regarding that, please consult with your physician. Now, my personal experience, I've been on Zoloft for some time, and it does help with reducing the anxiety and depression, and it also helps with reducing suicide tendencies that I've had. As far as reducing insomnia, improving concentration, hasn't done anything for that. In fact, it's just around 5 in the morning now as I'm taping this. So insomnia has been part of my life for many, many years, and I've just learned to accept it, I guess is the best way to put it. So if you are battling PTSD, there are a number of resources you can use, and I just suggest personally, as myself with battling this and epilepsy, please take care of yourself and find some way to heal and move forward. In conclusion, post-traumatic stress disorder is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event. People with epilepsy can develop PTSD due to anxiety and depression. There are different options available for therapy. To learn more about post-traumatic stress disorder and epilepsy, please check out our resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment down below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy.